Now, everyone is feeling the pinch, whether at the grocery store, restaurants, or the gas pump, including healthcare costs that continue to outpace inflation and wage growth. President and CEO of National Alliance of Healthcare Purchasers Coalition, Sean Grimminger, joins us to tell us how hospital systems may be driving up healthcare costs and negatively impacting employers, communities, and working families across the United States. Sean, thank you very much for joining us this morning. We really appreciate your time. So why should we be concerned about hospital pricing practices?
So over the last several decades, hospitals have rapidly consolidated, with larger hospitals buying smaller hospitals, or hospitals buying physician practices. And they've been able to leverage their size to substantially increase the price that they're charging to employers, purchasers, and working families. We've seen hospital inflation at more than twice the rate of overall inflation. And Florida actually happens to be one of the highest priced hospital markets in the country, with the average hospital in Florida charging almost 4 times what Medicare would pay for the same service.
That's disheartening and rather concerning. All right, so Sean, how do hospital pricing practices drive up costs for employers and local businesses?
Sure. So employers, in most cases, actually pay directly for the cost of healthcare for their employees, or often they may buy an insurance product, and then those prices are built into the premiums that the employers pay. So if you're a Florida employer, whether it's a private company or even a public entity like a city or a county or the state, you're paying for these astronomically high prices. That ultimately ends up impacting the employee in a number of ways. People are paying more out of pocket for healthcare when they actually go and see a physician. They are paying more in their monthly premiums, and they're paying more for prescription drugs. One of the biggest challenges we have in the hospital industry is that they substantially mark up the price of drugs. So they'll buy at a relatively low rate, mark it up to multiple times what they purchased it at, and sell it to the person who is insured. The impact in the end is, as you said, sort of family budgets are squeezed. People have less money to go around to be able to afford things like school, cars, utilities, etc.
So let me ask you, you're just saying it's a pretty big impact on employers and working families, right? So how do they affect health premiums and wages?
Yeah, so premiums have been going up, as you know, year over year, many times 10, 15, 20%. And that ultimately means, of course, people are paying more just out of pocket for their healthcare, but also there's a real impact on wages. So if you're an employer, you hire an employee to work at your company, you're not just thinking about how much is that going to cost in terms of their salary, you're looking at their overall benefits package, right? That includes health insurance, life insurance, et cetera. When the healthcare costs go up 10, 20, 25% a year, that means that you just have less money to be able to increase wages, which is a big part of the reason why, working families feel like they're being squeezed. They haven't been seeing their wages go up fast enough to make up for all of the rest of the inflation in the economy. And it's hard for employees to see, but a big part of the reason that their wages aren't going up as much as you'd like is because the employer itself is having to pay more for their healthcare.
That makes sense, and very unfortunate as well. Okay, so let me ask you, how do hospital pricing practices affect underserved communities, care deserts or rural communities?
Yeah, this has been a big, hot topic in Washington, D.C. and in Jacksonville. We know that there are real challenges with access in underserved and particularly rural communities. Interestingly, I've talked about hospital consolidation, hospitals buying other hospitals. Hospital systems tend to buy practices and hospitals in higher income areas, right? They want to make as much money as they can. And that means that those places that don't necessarily have a lot of folks or higher income folks that can pay end up getting underserved, which is why we see rural hospitals going out of business. We see rural physicians leaving their practice and going to urban areas. It's creating real access challenges for underserved communities and particularly rural areas where people just can't find access to care. They've got to drive sometimes hundreds of miles to be able to actually get healthcare.
That is very unfortunate, because as we have millions of people who live in rural areas in this country, that is devastating. All right, sir, so before I let you go, where can we go to learn some more information?
Yeah, so the National Alliance is really pleased to be leading a campaign called Employers Against Hospital Price Abuse. You can go to our website, hospitalpricingabuse.org, and you can learn more there.
Fantastic. Thank you very much for your time this morning. It's a fascinating conversation. And guys, if you want to watch this segment again or others like it, all you have to do is head over to First Coast News Plus.